Hello, I'm Aggi Kozlowska, and this is part 2 of the video on low back injury. Just as a reminder, yesterday I injured my back, low back, and I decided to journal my journey to recovery. It is COVID-19 at this point, and we cannot see anyone, or I cannot see anyone, therapist, my colleague osteopathic practitioner, or anyone who can help me. So I am trying to help myself and have decided what a great way to show what to do or what not to do when we're trying to help ourselves or we can't get to our therapist in time. Saying that, even if I was able to see anyone, I would still be following certain steps, just my recovery would be a little bit faster. So it's about 24 hours, and let me recap what happened. Yesterday morning, I was reaching down to pick something off the floor. It was first thing in the morning. I was not warmed up. I have been working out a lot more. I have been walking a lot more, but I have not been stretching enough. And I do have pre-existing low back weakness, if you want to call it. It's not an active injury, but there has been an injury in the past. And at this point, it's an area that I definitely need to pay attention to. And I haven't. I got in the way with just feeling great and doing probably a little bit too much. So I leaned forward. I reached for something, I felt a little click, and I knew I've injured myself. I've been there before. So right away, I leaned back, and I explained all of that in my part 1 of the video. What do we do 24 hours later, 2-3 days later, when our back is not better? It may hurt more. First of all, I'm gonna talk today about a situation where it's actually not getting any worse. I'm gonna assume it is as is, meaning it's not getting worse, maybe it's even improving a little bit. If it was getting worse or staying the same, I would continue with what I've explained yesterday. That would be part 1, and we stay there until we are able to get a little bit more movement. But let me talk about what can be happening within the first 24 hours or 2-3 days post-acute injury or re-injury of your low back. First of all, we may find that it's not just low back that hurts anymore, but it's actually our middle back, maybe our neck, our hips might be getting tight. All of this can be happening because a segment of our spine is not working properly. First of all, whenever we injure ourselves, the area immediately around that region, around that spine segment, tightens up. Our body is trying to protect that area from further injury, and it's going to really tighten up. So it's going to hurt and it's going to feel really, really tight. That's going to add to the pain. So typically we have almost 2 types of pains going on. One, it's the actual injury, and then second one may be happening and causing pain from actual tightness in that area. However, over time and over the day, as we're trying to move around, unless you're totally flat on the floor, which also gonna hurt, your area above the injury and below the injury is gonna start hurting as well. The reason for it is we can't use our mechanics properly, so everything is starting to get affected. In this situation, my mid-back tightened up, my neck has tightened up as well, and so did my hips. The worst area for me is my mid-back. That's what I feel I have the least movement and the most discomfort post-injury in my low back. I definitely feel my ribs are not moving just as well because they are attached to that mid-spine as well in that area, and therefore I'm not having that movement as I should. What else can be happening? The nerves coming out of the low back region also affect structures in the front of our body and muscles and organs. Therefore, in some instances, we might feel that there's a little bit of pain or discomfort happening in the front corresponding to the back, the same kind of region or very close to it. It's normal in a sense. However, I'm not saying just disregard it. If you feel there's something you need to check on, absolutely. I'm just discussing what can be happening in that situation. I did have a little bit of that discomfort yesterday, actually. I felt a little bit of pain maybe or achiness through my lower abdomen, and it passed. It's normal for me because it happened. If that's normal for you, then I would say sort of wait it out. If you are unsure and all of a sudden you have a lot of pain happening in your low back, get it checked. Sorry, not low back, but in the front as well, get it checked out. Obviously, whenever you're unsure, don't just wait it out. Make sure you are getting proper medical help. On that note, let's go back to the tightness. So I have not been able to move as well as I would like to. I was able to go for a small walk. However, I do feel everything's pretty tight on me. So I would like to show a few stretches today that we should be able, if we are tracking on feeling a little bit better, to do 24 hours, maybe 2-3 days later. We are gonna do anything that does not hurt. Basically, no pain, no gain does not apply here. We wanna make sure we don't hurt. We wanna get to that place where it almost hurts, but we're not gonna push it into a very painful area. We're not gonna try to stretch it and say, okay, I'm just gonna go for it. It doesn't typically work because you have a fresh injury, and it probably happened because you have overstretched something or you moved too fast. So if you start doing something that is essentially resembling how you've injured yourself, your body is gonna say stop, it's gonna say no. A few things may happen. You might not be getting better. You might injure yourself further, or something else might get injured actually. So let's not try that. So we're gonna start actually on our stomach. Let me explain what happens here. I feel better in extension because I lean forward and that's how I injured myself. So I'm gonna start with a little extensions for my low back. These are active stretches, and I'm only gonna do them to the point that does not hurt. Saying that, extensions make me feel better overall, and I have been doing them yesterday as well because I was able to maybe feel okay doing it, not feel any more pain. So I moved on and then did it. You can wait a little bit or you can start the same day. It's hard to explain. It's really a case by case situation. Whenever I talk to my patients, I ask a lot of questions, and based on that, I give guidance of what to do along with the treatment. In this situation, I'm trying to give the rules and tips and hints of what to do without really knowing your individual case. So I'm always gonna suggest proceed with caution, stop if it hurts, and if you feel you need medical attention, definitely go and do that. So first of all, we're gonna get on our stomach. And I'm gonna apologize here because I have a mic attached right up top here. And I did figure it out that whenever I lay on my stomach, it goes a little bit louder. So we're gonna try to deal with that. But if all of a sudden we are hearing a lot more of me, that is the reason. So very slowly, I am going to lay on my stomach as I explained. Here we go. And I'm trying to position myself so I'm nice and straight. I also wanna make sure my shoulders are not hiked up by my ears. So I set them back. If you have to, you may put your face down on a carpet or on a little tiny pillow or towel, or if you can, go with your forehead down on the floor if your neck hurts, especially if your neck hurts. From here, what we're gonna do, as I said, set your shoulders back. I'm gonna activate my abdominal muscles. I don't want this area to be just passive. I wanna start activating and restarting my muscles again so they start working properly. So what I'm gonna do, I'm actually gonna come up here, contract my abdominals, not too much though, because otherwise it's gonna oppose what I'm trying to do. And very slowly, gonna go into extension. Come up here, and then slowly bring myself down. First, I'm gonna test the water. Does it hurt? Do I feel okay? In my situation, it actually feels better. So I'm gonna do it one more time. I'm gonna come up and then bring my arms forward as I keep my shoulders down so I'm not crunching my neck. And I'm gonna start hanging out here. I do feel stretch in my abdomen as well. I am trying to pull my abdomen muscles in a little bit. And I'm just gonna show what happens if I don't. When I don't engage my muscles in my abs, I'm gonna sink in more here. When I pull through my shoulders and my abs, and maybe a little bit more glutes, although I don't want to do that too much, I'm gonna come up higher and I'm gonna keep everything activated. And really the goal here is to start activating the muscles and reversing what happened at the time of injury. So one more time, I'm gonna lower myself down. I'm gonna lift, arms come up, gonna hang out here. My abs are working at this point. I'm pulling my stomach actively in. I'm also making sure I breathe because sometimes it's easy to stop. There's pain, there's so many moving parts. Oftentimes we stop breathing when we're trying to focus on something. Make sure you breathe. If you want and if you feel that this is really making you feel better and you are capable of, you can try to move yourself ever so slightly higher up. This is as high as I would go. Beyond that, I'm not gonna feel too good. If you go too high, you are at risk of creating a new injury, which would be a compression injury, when you compress that part of spine and you go too far. So I would always say hang out here for a bit, take a few breaths, and then slowly bring yourself down. And once again, rest, activate your abs, see how things feel, and if you have to, make sure that you go back up. From here, I'm gonna show a couple of things we can do on our backs. Whatever you are getting out of the stretch, especially when injured, make sure you do it slowly. So I'm gonna pop myself on my arms, come up, engage my abdominal muscles again, and I'm gonna slowly move around and switch. And I have my pillow here, ready to go. So I'm gonna support my head with the pillow and slowly lay myself down right here. Here we go. All right. So once again, I'm gonna settle myself and make sure that everything is feeling fine, that I'm laying in a straight line. My shoulders are away from my ears. That's very important because we're trying to set ourselves as well as we can without having any external help. From here, I'm gonna right away point out that I am maintaining that slight extension. I've explained a few times that this feels better for me, and therefore I am not actively forcing my low back into the floor. So in a perfect world, I'm gonna try to keep it in the neutral. And I will make more videos explaining what that is. But for now, let's assume that it's an area right in the middle before we extend all the way up or flatten our low back all the way down. We are trying to stay right in the middle of that. What I would like to do here, and why are we doing these things? Two folds. Number one, we want to restart the muscles, so get them to start working for us again. We want to stop spasming. And lastly, I guess there's a third one, we want to bring our range of motion back to where it should be. We're not hoping for full range of motion today. We just want to start doing a little bit of work. Movement increases circulation. Movement helps. So therefore, if we can, we're trying to get a little bit. So from here, I'm gonna show how to do little tiny mini pelvic tilts. Again, I'm gonna point out that at this point, personally, I am not able to go all the way down to the floor. It might look like so, but it's only my shirt touching the floor. I am not actively pressing into the floor. So we're trying to do mini pelvic tilts. So we're gonna come up, create that space, and then as I exhale, bring myself a little bit down, and then slowly come back up. And again, when I come back, I don't overarch my back because I can create a new injury. I don't want that. So again, let's do a few together here. Inhale to get ready. As you exhale, activate your ab muscles. Slowly bring yourself down and then lift up. Let's do 2 more times. And again, down and slightly up. Feels great. I have 0 pain at this point. And again, down. And I come up again. Couple more things I want to pay attention to are my hips and my ribs. As I explained, the movement happens from the hips, so we are tilting them a little bit down towards the floor and then back up. But same thing happens with our ribs. We want to make sure they don't splay out, they don't start popping too high. So as I come down, I want to make sure that my ribs try to hug my body. So down, and then as I come out, they slightly open, but we're not trying to go too high up. So we want to make sure that the movement comes from both ends, our hips and our torso. This way we're gonna start addressing that mid-back tightness as well and restart the movement of our ribs our abdominal muscles, our entire corset-like area here. So our low back and ab area. So one more time, inhale. And as I exhale, let's see, my ribs will come down as well. And up. One more stretch or movement that I like to do here are little hip circles. So here in my mind, I map out the 2 hip bones and my pubic bone. So kind of like a triangular area. And I'm gonna now try to draw a circle around those 3 points. So I'm gonna slowly start moving my hips and down and back up. So as I exhale, I push to the left, then I go towards the middle, my right hip, the lower part of my pelvis, my pubic bone, and then again, and I finish in neutral. This way I'm starting to add a little bit more activity and movement, and hopefully that helps again. Then, if I'm really adventurous, I do it the opposite way. So I change direction, and that's starting to stretch that spine in our low back. So it's lumbar spine. And again, I add a little bit of movement. From here, you might have heard, and this is a little bit controversial, about bringing your knees up to your chest to stretch. There's 2 schools of thought on that. If you have a bulging disc, that may be a little bit too early. You don't want to be bringing or flattening that back down too much. When you bring your leg up, your low back typically goes down. So I'm exaggerating the movement here. And if this is how you injured yourself, it may be something that it's too much at this point. Eventually, yes, too much now. So you can try as long as you can keep your back in neutral, meaning you are not forcing it all the way down. If you can distinguish the 2 movements, and I can now bring my leg without flattening my back too much, that's okay. However, if it hurts, if it feels tight, I would say don't do it yet. All right, so one more time, we had our extension on our stomach, we have a very gentle pelvic tilt, and then we had little tiny pelvic circles. I would like to stop here. However, I will create a couple more videos about what exercises can we do as we continually feel better. Let me just come up, and I always welcome your feedback. So if you like to make any comments or suggestions about what to do for future videos, absolutely send me a message. I'm happy to do it. In fact, that's my goal, to help you feel better. Thank you.